Hello, everybody. I'm Tom Frieden. I'm a physician trained in public health, epidemiology, internal medicine, and infectious diseases. I was health commissioner for New York City. Then I was the director of the US Centers for Disease Control and Prevention. And now I run an organization called Resolve to Save Lives, which is focused on partnering with communities and with countries to save lives around the world. Today, we're going to talk about public health emergencies. We've had a few of them recently, particularly the COVID pandemic, but also extreme weather events, terrorism, and other big problems in countries all over the world. So, what can you do as an individual and as part of a community to be better prepared? How can we be better prepared before, during, and after emergencies in order to reduce not just disability, injury, disease, and death, but also reduce the disruption that the emergencies of our modern world causes? I'm going to talk for a while and then happy to take questions. The first thing that every one of us can do is to make sure that our government is doing what it has a responsibility to do to keep us safe. Now, some people may think, hey, wait a minute, that's individual responsibility. And absolutely, every individual has a responsibility to do many things. But government also has a responsibility, and it's in all of our best interest to make sure that it's doing its job. Part of its job is running a good public health program. Public health is nothing more than the organized activities of a community to protect and improve health. A strong health department in your local area could save your life. The government has an obligation to protect people. That doesn't mean nanny state. That means protect you from a drunk driver who could run down and kill your kid. Protect you from a hospital that's not doing good care and results in avoidable deaths among its patients. Protect you and us and all of us and our children especially from industries like the tobacco industry and alcohol industry and junk food industry that are getting our kids addicted to their deadly products when they're kids. That's something that all of us can do as individuals, but we can do much better if we band together and insist that our government does a good job of it. That also includes a healthy environment. You can buy all the air purifiers you want, but if your government isn't controlling air pollution in your area, they're not going to be very effective. You can boil your own water, but wouldn't it be better if you could get fresh, wonderful water right out of your tap? You can choose healthy food and grow it in your backyard, but wouldn't it be better if the food that we could buy at the local market was healthy and affordable? You could hold your breath when you go out to restaurants and bars, but wouldn't it be better if there weren't cancer-causing chemicals there? Also, good public health means good two-way communication. Communication is not about government telling you what to do. Communication is about government listening. It's about public health officials understanding what the concerns are in a community and then addressing those concerns with empowering information. Take COVID. Wouldn't it be nice to know how hard it's raining COVID in your community? Maybe you don't care. That's your choice. Maybe you've got leukemia, and when it's raining COVID hard in your community, you want to wear an N95 mask when you go out, or maybe you don't want to go out, or maybe your outside activities are so important that you want to do them even if there's a risk. A responsive government acts to protect and improve health by promoting free and open information, by protecting you and others from the harm from others, and by working together to promote health. Now, that's about what our government can do. What about us as individuals? Because to say government is responsible doesn't mean people don't also have a responsibility. We all do. It's a shared responsibility. One of them is our resilience. Now, you can choose. Some people don't want to think about it. Some people don't want to prepare. Some people, in my opinion, might be a little bit over preparing. But bottom line, you can be better prepared for emergencies by getting and staying as healthy as you can be. Healthier people are more resilient. Healthier people are less likely to have big problems in an emergency, whether it's an earthquake or a fire or a pandemic. What does that mean? Well, We'll start with the single most important thing. The single leading killer of our time is heart disease. That's what most people will die from. And most of those deaths are not necessary. They're avoidable. They're avoidable with low-cost, effective interventions that can make a really big difference. One of them is not smoking and not being exposed to tobacco smoke. Tobacco continues to kill about 500,000 people a year in the United States. Another is making sure that your blood pressure is under control. Because of our modern diet and other factors, about 70% of people will have high blood pressure by the age they're 65, and it increases with age in our communities. Making sure that if you have high blood pressure, you take medicines every day can save your life and prevent you from having a stroke or a heart attack or kidney failure or other serious health problems. Physical activity is the wonder drug. Do something you love doing. If you love going to the gym, great, do it. But if you love taking a walk in your neighborhood, do that. Figure out what you're going to do that you will enjoy enough to keep doing it at least 3 or 4 days a week for at least 30 minutes to raise your heart rate and break out a little bit of a sweat. Physical activity makes it less likely that you'll get cancer or diabetes or high blood pressure or depression. It'll make it easier for you to sleep at night and more likely to not have arthritis or other joint problems. You also want to have a balanced diet, and that includes reducing sodium, using low sodium salts as long as you don't have kidney failure, getting enough sleep, avoiding harmful amounts of alcohol, and take medications as prescribed by your clinician. That means having a doctor or a care team that you can get care from. And here's something where personal and collective responsibility combine. Every person should have a primary care team that supports them and protects their health. And yet, more than 100 million people in the United States don't have a regular doctor. And that's despite the fact that we spend more than $4 trillion a year on healthcare. It's an inconceivable amount, but it's an especially inconceivable amount considering how poor our health status is and how poor the access is for healthcare. That means you as an individual should do what you can to get good healthcare, but we as communities should demand that the government do a much better job of making sure that every person in every country, including the US, has access to good quality primary health care 24/7, 365. No excuses. Demand it. Now, there are also things that we can do to protect ourselves. Wash your hands. Washing hands is really important. A lot of germs are out there. I don't mean washing hands 100 times a day, but after you use the bathroom, before you touch your face, before you go out and eat, before you put something in your mouth that you have made, washing your hands is very important. Reduces your risk of getting all sorts of infections, keeps you healthy. Also, being prepared. Now, as I said earlier, you might go overboard with this sometimes, or some people might, in my opinion, but there is a minimum that you may want to consider. Having a go bag. What are the most important things to you? If you've got to leave your home suddenly, what are you going to really regret not having kept? Maybe that's some precious photographs from the past or some documents that you need. So having things in a place where you can reach them quickly and get to them and go, that's something you might want to consider. That's not something anyone should force you to do, but to empower you to feel more comfortable, that's something you might want to do. In the car, you may want to have water, some food in case you get stuck for a while, a blanket. Your family, you need to have a plan. If there's a problem and you don't have phone service, most of us, our phone is like our brain. If we don't have the phone, we don't remember anyone's phone number. We don't have a way to meet with people. What if we lost phone service or lost our phone? How are we going to reconnect with our loved ones? That's something that's worth having a plan for, or at least thinking about it. And be sure to think about the needs, especially of our children, and don't forget our pets. What we find in emergency after emergency is pets are part of the family. And if we don't have plans for them, it's going to be a problem. We've had situations where people absolutely refuse to leave unless we can also evacuate the pets. And that's a valid concern that has to be addressed. Now, I want to end before taking questions on something that's been really controversial and also, I think, really misunderstood. And that's the importance of masks or the role of masks. Now, this got really unfortunately politicized and made partisan during COVID, but it didn't have to be. Let's be clear. If everybody wears a mask when there's a respiratory virus spreading, there's much less spread of that virus. In countries like Japan and Korea, where people routinely wear a mask when they're feeling sick, there's much less illness from influenza each and every year. In fact, almost 15 years ago, I said, I wish in the US people would have a similar system or culture that if you feel sick and you have to go out, wear a mask. It's the considerate thing to do for others. If you got a fever and a cough and you're out there coughing on a bus or train or subway or a crowded space, that's kind of like you went to the bathroom and you didn't wash your hands. It's kind of gross. So if you're sick, stay home. If you have to go out and you're going to be around other people, indoors, wear a mask. Doesn't have anything to do with COVID as a general rule. Now, for those of you who either have an underlying health condition and are medically vulnerable, immunosuppressed or in lung disease, or you're worried about long COVID because it can be serious, and still about 6% of people in the United States are experiencing long-lasting symptoms of COVID, then you can decide. You decide when you want to wear a mask. If you're a grandparent and you're visiting your grandchildren, maybe that's so important to you that you're going to take a risk and you're not going to wear a mask. If you're going out to a busy shop and you don't really have a lot of friends in that shop, maybe you want to wear a mask. You decide. But you decide based on the basic information, which is how much COVID is spreading in your community, what are your risks and your benefits, what do you want to do, and respect the decision that other people make on whether to mask or not. Now, finally, what kind of mask to wear? If you're wearing a mask to protect yourself, I recommend either a KN95 or an N95 mask, one that fits tightly around your face and has a good quality filter to protect you. So let me stop there, and I think we've got some questions coming into the chat. And let's see. The dangers of sedentary lifestyle. I've talked about some of that. Sedentary lifestyle, not getting physical activity, makes us less and less conditioned, more likely to be overweight or obese. More importantly, whatever our weight, less likely to have the kind of edge that we'd like to have in our thinking and our physical health. Now, how can we avoid being sedentary? I think it comes down to doing things you love. If you hate doing one or another kind of exercise and you do it as a chore, you're probably not going to stick with it. But if you find something you love, maybe it's dancing, maybe it's walking, maybe it's playing a sport that you really enjoy with friends, doing something that you enjoy and doing it at least 3 or 4 days a week. Second, what advice can you give parents whose doctors say, I don't know what this is, it's viral, and how can we deal with illnesses? Well, if your kid is sick, the thing that we always want to rule out is that it could be strep throat. And we can do that with a quick test that's pretty accurate, give you an answer in 20 minutes. Because if it's strep throat, they need antibiotics because they could get a serious complication. It used to be very common, something called rheumatic heart disease. Now it's very rare because we treat strep throat before it turns into that. So if it's not strep throat, then it might be viral. There are other bacterial illnesses that need treatment, but we also don't want to overtreat with antibiotics because that can cause problems. There are some better treatments coming down better ways being discovered of distinguishing between bacterial and viral infections, but they're not quite ready for prime time. Next question, what have we learned about communicating science-based public health remedies to politically conservative communities that don't trust scientists and government voices? How do we better engage trusted leaders in conservative communities, such as their pastors, bishops, imams, politicians, to lead on public health initiatives? It's a great question, and you answered it, which is, first off, what I found is it's very important to listen to people. Communication is not about preaching to people and ordering them or telling. It's two-way. It's listening. What are your concerns? What is your perception? What do you think is happening? What would you like to see happen? What is your goal? And with that, share information. Here's the way we see it. Here's what the information is. Tell them what you know. Tell them when you know it. Be first, be right, be credible. These are fundamental messages, but we need the right messages and the right messengers, and that includes working with people from within the community. There are always going to be a small number of people on any issue that are not able to be convinced, and engaging with them is probably not going to be productive and may be counterproductive. But most people want to understand more and want to be constructive in encouraging their community to stay healthy. The pandemic is officially over, but COVID is still alive. What is the government responsibility post-pandemic? Another great question. First off, we need to do much more to stay prepared, to become better prepared for the next pandemic. In the US, more than 1 million people were killed by COVID. Around the world, 20 million people were killed by COVID. At least half of those deaths in the US and globally did not have to happen. They would not have happened if we had had a better public health system. So we need a much better way to strengthen our public health system in the US and around the world so we can find problems quickly when and where they first arise and stop them quickly at their source. We've suggested from my organization, Resolve to Save Lives, a global target called 717. Every single health threat should be identified within 7 days of its emergence, reported to public health within 1 day, and all essential control measures in place within 7 days after that. If we did that, the risk of a deadly pandemic or epidemic would be drastically reduced. We need to insist that we don't have another panic and neglect cycle. That's what happens after most epidemics and pandemics. We have to learn from and honor the memory of the people who died in COVID, especially the healthcare workers who gave their lives to care for other people, to say never again should we be so unprepared, so uncoordinated, so separated. Never again should we have such a failure of unity within the country and within the world to say, hey, we may disagree on a lot of things, but we have a common enemy here. It's not a person, it's not a group, it's not a country, it's a microbe. And let's work together against it before the next pandemic, so the next pandemic can be much less deadly. Do you have information on how physicians and specialists are getting to the affected Maui? I don't have information about the tragic events in Maui. I do know that it's an enormous challenge and an emerging and evolving problem, and we all wish the people there well and hope that those affected and the rescuers have all of the support they need, not just for their physical safety and their health, but also for their mental health needs. Can nutrition help lower blood pressure, cholesterol, and blood sugar? I've been doing this and starting to see results. Thoughts and suggestions. This is a great example of something that's both a government responsibility and an individual responsibility. Government should be doing much more than it is. We should tax sugar-sweetened beverages. They're a driver of obesity. We should limit the availability of junk foods in public places. We should stop subsidizing unhealthy food. Ideally, we'd do things that currently the legal system in the US probably wouldn't support, like big, bold labels on the front of unhealthy food saying this is unhealthy, so that you could be empowered. There are also things that individuals can do. Again, find food that you love and it's healthy and have more of it. If you're eating food that you think is gruel, you're not going to stick with it. So you need to do something that you can persist in doing over time that goes well. That means lower salt. You can use low sodium salts or salt substitutes. Very important. The single deadliest thing that we have in our diet is too much salt. And then you can think of ways to cut out sugar, eat more vegetables, eat more fruits, limit portion size, drink more water, not necessarily because you need to stay hydrated, but because that makes you feel more full. So there are lots of things that we can do to eat healthier, but we should also demand that our government do more to make our food environment a healthier food environment. Last question, how can public health policies account for more preventive medicine and treatment? Let me tell you, over the past century, the increase in life expectancy in the United States and around the world is primarily from public health interventions, not from healthcare. In the coming decades, most of our progress, if we get it right, will be from public health interventions, things that we do as a community to stay healthier, whether that's reducing tobacco use or improving the healthfulness of the food that's readily available, or improving our healthcare system so that it stops being the kind of expensive, inefficient, all too often impersonal disease care system that it is today, and is a system that protects each and every one of our health when there are emergencies and when there are not emergencies, so that as a community, as a country, and as part of the world, we could be more resilient before, during, and after the next emergency. Thank you so much. It's been delightful answering your questions, and I look forward to continuing to engage on the Medium platform.